we have a 55-year-old woman with diabetes presents to the emergency due to swelling of her left leg, fever and chills for the past 2 days. The woman's maximum recorded temperature at home was 38.3 Celsius. Left leg is red and swollen from her ankle to the calf with an ill-defined itch. Her vital signs include BP of 120/78, pulse is 94, temperature is 38.3, okay. Respiratory is 16, and physical examination, her left leg shows marked tenderness and warmth compared with the other leg. The left inguinal lymph nodes are enlarged about 3/3. What do you think is the chemical mediator that's most likely causing the fever in this patient? Now here they wanted to know, they were asking why is fever caused, okay? So PGE2 was the answer. Why? Because this mediates pain by increasing the sensitivity of peripheral nerve endings. It also causes fever. Now, endotoxins, tissue injury, microorganisms, and microbial products do what? They activate macrophages. And your IL-1 and TNF-alpha from the macrophages will go increase your COX activity in the perivascular cells of the hypothalamus, and they'll raise the hypothalamic temperature set point by centrally produced PGE2. So the PGE2 is involved in your temperature setting by the hypothalamus. And how does it happen? Macrophage getting activated, and that will release your IL and TNF alpha, which goes to your perivascular cells of the hypothalamus. Straightforward. Okay. Why not LTB4? LTB4 is also produced from arachidonic acid, a lipox pathway, not COX pathway. What does it do? It induces the recruitment and activation of neutrophils. So it helps in chemotaxis. That's simple. You just learned, right? C5a and LTB4 they increase the integrins in your leukocytes, so that it goes and binds to your endothelial cells. Okay. Now it activates your neutrophils, monocytes, eosinophils. We've learned that integrins are upregulated. The interaction, I just explained that, so we don't have to read it. So LTB4 does not cause fever. Histamine is produced by basophils and mast cells. What does it do? It causes bronchoconstriction and vasodilatation, pruritus, and all that. AE metabolites mediate acute inflammation. It's produced from membrane phospholipids by phospholipase A2. Breakdown of arachidonic acid by COX produces prostaglandins I2, E2, E1, F2, and thromboxane. Thromboxane E2. Okay, PGI2 mediates vasodilatation and increases vascular permeability. Now, for this, I would my suggestion for you guys would be make a table, okay, and write down what each of them do. What does PGE2 do? E1 does, F2 does, I2 does, thromboxane does, and what does your LT A, B, C, D does? Okay, I don't think there's D, A, B, C, E does. Okay, remember that. And bradykinins. And certainly all of the interleukins are important. It's given very beautifully in your first aid. This is just something you have to remember. There is no choice, and I'm sorry to say that. Okay. Now, bradykinin is an inflammatory mediator that causes vasodilatation. So it causes decrease in blood pressure. It also causes contraction of smooth muscles of the bronchus, okay, causing bronchoconstriction. It increases vascular permeability because there's vasodilatation, and it mediates pain as well. It does not cause fever. It should be your first option to rule out bradykinins. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.